Parliament in Malaysia is reconvening after 7 months. An emergency declaration in January gave the government wide-ranging powers, including suspending Parliament. On Monday, politicians questioned not just the need for an emergency declaration, but also the government's coronavirus response.
There's been double standards in following the procedures that the government itself has laid out for COVID-19. There's also been a widening trust deficit, which is actually difficult to manage because the government faced this when it came into government, but it's actually widened in the course of the long extended COVID-19 management.
Much of the country is still under a lockdown imposed last month. It has caused great hardship for many. Yet, coronavirus cases keep climbing. Malaysia has now recorded more than 1 million COVID-19 infections since the start of the pandemic. The number of active cases is at record levels, putting the healthcare system under severe strain. Public healthcare practitioners say Malaysia lost an opportunity to beef up healthcare resources when it experienced a lull in new infections last year.
There should be a lot of focus on expansion, hospital capacity, one thing. Second thing is obviously public health measures like contact tracing, testing. These are things that could have helped to curb subsequent peaks to be a little bit lower.
The government is now also having to deal with contract doctors who are unhappy with their terms of employment. Across the country, thousands of doctors staged a walkout on Monday, demanding permanent postings and better pay. Florence, Looi, Jazeera, Kuala Lumpur.